29th September is the World Heart Day. And why do we celebrate the World Heart Day? We have to accept that we cannot save everyone. We always have to come from our space of compassion. And then around 200, 300 odd people came into the hospital and started breaking all the hospital stuff.
Oh my God.
A lot of people say alcohol, like one glass of wine is good for your heart. I'm yet to come across that scientific literature. Legs are the peripheral hearts. More specifically, if I say the calf muscles are your peripheral hearts. We are responsible for our own health. Nobody else is.
Hello everyone, welcome to another episode of the Rangman Show. Today we have a very special guest for you. We have Dr. Arnab. He's a practicing cardiac surgeon. He's also a gold medalist in MCH, which is a full form that I tried to remember before the show, but I don't remember anymore. So please do the honors and tell us which field you are in a gold medalist in.
Thank you for having me here. So I'm a practicing cardiovascular and thoracic surgeon. I did my MCH from Sion Hospital, and in that exit exam, the said gold medal was
Absolutely
procured.
Humble and modest, as you can see. Also, one more thing about Arnab is that Arnab is a very good friend to have, but also he's a brilliant cardiac surgeon as well. And he's recently started his own thing. He's practicing on his own while after a long stint at Sion Hospital and a bunch of other hospitals.
So I was in Apollo after that, and then worked
Yeah.
with a bunch of people. And then quite recently, I have started doing my own thing, like where I am the chief surgeon and I am like treating patients under my name.
Superb. So on this occasion, because heart health is right around the corner, so we thought who best to call other than a cardiac surgeon. So right, let's address the elephant in the room. Indians are horrible at heart health, aren't they?
So just let's first, 29th September is the World Heart Day. And why do we celebrate the World Heart Day? For this reason only, the thing that you said, to spread awareness on the ailments of the cardiovascular diseases so that we can be better and preventing them. And we can do that by prevention. At first step is lifestyle choices,
Right.
especially, which is very important in today's day and age. And with that, that's a start. And then obviously we can talk about what are the heart symptoms, what are the things that at what age, what things we should be wary about, what should we be considering when we are like thinking about, am I in good health? At what age we should start getting our annual checkups done? What
Right.
should that look like? We can all discuss that during the show.
So tell me something right off the bat. You said what age should we start getting our annual checkup at? What age should actually somebody start getting their annual
So
checkup?
generally in most of in Japan or in the US, around 40 years is taken as the standard age. So you should always get an annual checkup, start at the age of 40 at least. Get a yearly blood test, blood panel done, get a
Right.
yearly ECG done,
Right.
get it checked by a general physician or a MD person, MD medicine, or even a cardiologist if you would prefer one, and see if there is any signs, especially in today's day and age. And also if you have a history, if you have a family history, which is a
Right.
very strong predictor, or if you have any habits which are considered as risk factors, as we can talk.
Right. So tell me something, because when you mentioned habits and family history and everything, and also the age 40, a lot of Indians, especially, and there's a myth busting, if I may call it that way. A lot of Indians think that, and a lot of people in the world think that, like, for example, COVID vaccine is responsible for like people getting heart conditions under the age of 35, 40 or something like that. Even if you remove that, myth, because we'll get into that, there's also a growing trend of people who are basically falling sick or having heart conditions, dropping dead, if I may have to say that. Very unfortunate, but they're dropping dead at the age of 30, 35, 32. And they're not, some of them are in not very good health, but some of them are in the pink of their health, but that's still happening. What do you attribute that to?
So first thing I would say, is a very sad thing to see young people die. But in today's day and age, the stress of the living and the lifestyle choices are the first. Are the these two are the most important factors which generally predispose an individual to having a cardiac problem.
Right.
But that being said, exception is always the rule. There will be people who will be apparently in the peak of their health without any problems, without any issues, but they're having that event, which means that there was something wrong.
Absolutely.
So obviously, we cannot, again, like this, the exceptions cannot be taken as a norm rule.
Right.
So again, if anyone at 30 wants to get their cardiac checkup done, they're more than welcome to get it done. But obviously, it takes a lot of uh, information, lot of motivation on the part of the person,
Right.
to have that kind of awareness
Right.
that okay, there is like 1 in 1,000 chance of me having a heart condition. Let me go and just get it checked. We did not do it when we were 30.
Right.
I'm
I
sure
did it a couple of years ago. I did a couple of years
you
ago.
did it a couple of years back.
Yeah.
But generally, these are preceded by some form of event that happens in that individual's
Yeah.
lives or their known people,
Yeah.
which pushes them to
I
these
agree. Yeah,
things.
that's what happened.
In with World Heart Day, the initiative is to make sure that the awareness reaches the mainstream population, and they also be a part of it. That way, a lot of these events can be prevented, may be prevented. And yes, you're absolutely right. There has been an increase, also because there has been an increase of these things getting reported, getting detected.
Right.
That also has increased.
Right.
But obviously, stress is a major factor in heart disease.
And slight sidebar to the whole thing. COVID vaccine is safe, right? People have been saying so many.
Again, research does not indicate COVID vaccine to be causing heart problems. But again, the research is very limited time.
Right
It's
now.
been around for the last 4 years.
Yeah.
But there has been instances where there is a few papers quoting it has caused clotting in the blood vessels, which can be construed as like can be taken as true, because there I have also read a lot of research publications where they have quite a few numbers where there was a strong association with COVID vaccine and hypercoagulation. So, but nothing has been established or benchmarked. Otherwise, the authorities, WHO, would have taken the vaccine off the
Exactly.
market.
So there's no need to jump the gun.
There's no need to jump to conclusions. So there will always be conspiracy theories.
that is true. Like, for example, in terms of conspiracy theories, I don't know. I was reading a lot about RFK. Sorry, going in a different tangent, but RFK Jr. in the US political system, he's trying to take vaccines off the table itself. That's an incredibly stupid thing to do, in my opinion.
So when the generic drug market also came, there's a lot of, see, the point is that all fingers of your hand is not the same.
Yeah.
When there will be people, when there are humans involved, there will be corruption. So there will be corruption in pharmaceuticals, which may lead to a person think, oh, this drug is being marketed just because of financial things.
Yeah.
But that is always not the case. There are of researchers, there are people who are doing a job out of their inherent nature to help other human beings, to cure diseases. Those are molecules are there.
Yeah.
Those people are there who are trying to strive to get a disease-free world. So, like, again, there will be people in that who would try to benefit from them financially in some way, but that we can. So, my point is that you should always accept that the gray zone will always be there in every field.
In
I'm
every
sure.
field, yeah. So, but you should not like decide that okay, this is not, it's not completely black or white.
It's never going to be completely black or white.
So in that, from the black and white thing, and the one thing that reminded me that because we took a sidebar there, we were speaking about stress in some way or the other. I would like to know, for you as a practicing surgeon who basically has been on calls for 36 hours, 40 hours, 46, 48 hours sometimes, how do you take care of that stress? Because you being on that operating table is perhaps one of the most stressful things ever. You're essentially having a human's life in your hands. They're beating hearts.
So a major bulk of what we do is a coronary artery bypass surgery, CABGs, or popularly known as bypass surgery.
Right.
And ironically, operation theater is not the most stressful environment for us. Most surgeons, we enjoy being there. We love what we do. And because there is no other way we would have been able to do it day in and day out, do multiple cardiac surgeries in a day, or go through like 36-hour shifts
Right.
with like maybe a wink of sleep. Obviously, OT is a different environment. Whether it's stressful or not, obviously it is. There are times when the stress is enormous. So that is how our training has proceeded, right? So we did not start out as cardiac surgeons. We started out as budding MBBS people who would just treat fever or a sore throat. Then from that we went into surgery,
Right.
where we spent 3 years, 4 years, 3 years in learning normal open surgeries, laparoscopic surgery, general surgery. Then from there we chose our different branches where we
Right.
thought our uh, interests were aligned. That is one of the main points, that if you are, as you are doing this podcast,
Yeah.
you love what you do, right?
Yeah.
So that is why you are putting in so much effort.
Yes.
So that part is always there. Again, that mean that there is no stress? Obviously there are a lot of situations uh, where a lot like undue stress is involved, but we generally have a way of handling it, and also it does leave a mark. I will never not say that, oh, I am immune to all the stress in
Yeah.
my
Yeah.
work life, from my work life, but it does leave a mark. But then there are ways we can wind down, we can take a break, we can go for vacations whenever we. That is something that every individual has to identify for themselves. For every other profession, that is also the same. I think that way it is there. And also I the most important part which I have come to realize as I'm practicing is that we have to accept that we cannot save everyone.
Yeah.
That is the biggest truth that we have to accept as practitioners, that no matter how much I try, I will not be able to save everyone. So with that acceptance, I think you have to put in as much effort as you can for your patients till a point, because if I am not well, then I will be able to do zero for my patient.
Absolutely.
So that balance has to be maintained by by the doctor himself, and they have to really put that checks and balances in place.
That acceptance thing is a big thing, though. If you think about it, it's not easy to get there, right?
No, it is not. Even if I know that, still, suppose if any undue thing, like unwanted outcome happens for a
Right.
patient,
Right.
still it will bother me for at least 1 2 days, 3 days. It will bother me, although I am the one telling you that I have this acceptance. Still, for that acceptance to kick in and have an effect, it takes time and it takes practice.
Also, I remember you telling me off the cuff in one of the many conversations that we had, that one of the other stresses of the doctors is, especially ones who are doing it in a, is how the patient's family reacts. Most of the times they're great, but sometimes there have been instances of violence against doctors when things go wrong, and that's not a very healthy.
Absolutely.
That's not a very
See,
good, nice place to be in.
I think we have had this conversation. I'm having a deja vu moment.
Yeah.
What I believe is that we always have to come from our space of compassion, because when these untoward, obviously there are exceptions, and in no way do I endorse violence, but when these things happen, one first thing you have to accept that that patient relative the relatives, I'm not talking about violences in hospitals where some random person is coming
Yeah.
and throwing,
Yeah.
and like some party or politically motivated thing
Yeah.
is happening.
Yeah.
But suppose a person's son or a father is getting emotional and behaving in
Erratic
rude,
manner, if
erratic manner,
yeah.
or becoming violent also. First thing you have to realize that yeah, I am not, as a doctor, I realize that I am not there to take violence from anyone. That is number one. Number two is that obviously that person is not in the right state of mind.
Right.
The best possible way in that situation, in those situations, what I have seen in my personal experience is that first to be away from that situation,
Right.
to avoid that situation at all costs. That would be the number one. Be do not to get yourself agitated.
Right.
Be calm and let the authorities do the whatever, take the steps, whatever is needed. And also, most of the times there will be one or two other people who will be calm in that situation. One person may, most times there is one person who gets super agitated, other people generally are calm who can take care of it. So if you lose your cool at that situation, then obviously it might get out of hand. But obviously the all situations are not the same. These are very
Absolutely.
volatile situations.
Yeah,
So
I
I,
agree.
like, you cannot presume to know what has happened in what situation.
Agreed.
But generally, if you just if you have an open communication with patient relatives from day one, day zero, from the point time they come, and you prime the patient relatives, most of the times these are avoidable. But then obviously there are instances when violence has happened, unjustified violence has happened, when people have taken advantage of someone else's grief and taken
Yeah.
and done things. So again, as I had said, in the corruptions and the things,
It's gray.
it's going to be there.
It's
There
going.
are gray
There are
areas.
gray
There will be
areas.
times. I remember an incident which happened in by UG college. So some patient died. Uh, there was an altercation, a brawl between one intern and the patient relative. The intern, they hit the intern. The intern called the friends, and then around 200, 300 odd people came into the hospital and started breaking all the hospital stuff.
Oh my God.
So now these things are always going to happen. Like these 200, 300 odd people, they had nothing to do with the incident, not with the patient. But they went and took advantage of the situation and basically uh, destroyed government property.
Yeah, yeah,
That's all.
yeah.
So that is there. That is that. Like, but again, these are all gray areas.
What I want to do right now is I want to take this conversation out of here. And I think we should go somewhere where Dr. Arnab can actually tell us about going into the great outdoors, where he said that he'll take us. So we'll go to the great outdoors and basically see.
Yes, let's go.
Let's
Let's do
go.
it.
Let's do that.
Let's do
Yeah.
it.
Okay. Whew. We are finally here to a different location, like we promised.
Yes.
Sanjay Gandhi National Park, because Dr. Saab said that let's do a lifestyle change and let's start with that. So you were talking about lifestyle changes. So let's.
Yes. So what I wanted to tell you was that in today's day, we are all very busy.
Right.
Very, very busy.
Right.
But we should not forget something. We have to move. We have to keep moving.
Right.
If you are doing a desk job, stand up after an hour.
Right.
Take a walk. If you are doing anything at home, take a break of half an hour. Go out for a walk. 10,000 steps doesn't matter. 1,000 steps is also all right. But just move your body. That is something that we should all do every day.
So let's start moving our body then.
Yes.
So what, like I was saying, when you said moving your body, about 1,000 steps and 10,000 steps, what do you think is the optimal amount? I know it changes for every person.
Yeah. So what I would like to say is that this is something very subjective.
Mm-hmm.
You need to get enough exercise. You need to burn enough calories. You need to get your heart rate pumping. Now that you can achieve in the gym, if you want to go to the gym, you like walking in nature like this, you walk in nature. You like going for treks, you go for treks. You like play badminton, play soccer, play cricket. But you should enjoy yourself while you're having that increased mobility. You should get your heart rate up, you should get your stamina up. And as we age, this is most important, because when we were kids, we all used to play.
Right.
We used to play in school, we used
Right.
to play in college.
Right.
What happens after college? We stop doing those things.
Right.
And after some time, it just becomes a way of life that we go to work, we come back, we lie on our couch, we watch a series,
We become very
and
sedentary.
we become sedentary.
Absolutely. What do you think is the optimum amount of steps that one should do in some way or the other?
See, you get a lot of apps today
Right.
telling you 10,000 steps, 30
Right.
minutes of exercise.
Right.
It is very, very catered to an individual.
Got it.
What I would rather advise is, first, you have to move. Second, do things to move that you love.
Right.
Like you like walking, you walk.
Hmm.
You want to walk on the road, you walk. You
Right.
walk in nature, you come here and walk.
Yeah.
You want to play, you play badminton, you play soccer.
Right.
You want to go to the gym, you like going to the gym, you like doing the treadmill, do
Right.
that.
Right.
Only thing is that your heart rate should be higher. There is obviously a calculation of that, but let's not get into that. So your heart rate should increase. You should be burning calories. Your cardio workout should always be a part of your workout, whether or not whatever form of workout you are doing.
Got it.
And swimming, cycling, walking, running,
Basically,
all
VO2
these
VO2
are
maximization and everything.
yes, all these are cardiac exercises.
And interestingly, some trainer once told me, yes, I used to go to the gym once upon a time. One trainer once told me that your ideal heart rate is 220 when you're working out. Maximum heart rate should be 220 minus your age.
Yes.
What is the science behind it?
So that is the highest heart rate one should achieve. One should aim to achieve while doing a high intensity cardiac workout.
Right.
But that again, let's not chase the numbers. Let's just chase the frequency, because what we do once we have started our lives in our basically mostly in our 30s, what happens is that we get caught up in the other things in life. We get married, we have kids, we have work, and that somehow reduces the time we give to ourselves.
Right.
So, and from 30 to 45, if you lose these things, then at 45 you will start getting your diseases, you will start to feel out of breath.
Got it.
And obviously there might be some organic lesion, organic disease, which is actually causing it. But a lot of it can be prevented by this primary prevention of moving around, exercising, living a healthy life. Obviously, we'll talk about the other aspects of lifestyle. Like tobacco in no forms. No, obviously. Second, a lot of people say alcohol, like 1 glass of wine is good for your heart. Very frankly speaking, I'm yet to come across that scientific literature. But again, like obviously alcohol is not going to be a problem that is going to come to you immediately. But smoking is. Smoking or any form of tobacco consumption. So that is the exercise part, the avoidance of harmful substances, and eating right. As we age, our eating should be regulated. In our 20s, early 20s, we could metabolize a lot more.
Yes, I remember those wild nights.
You could metabolize a lot more.
Yeah.
Now, obviously, it changes. It changes with time.
There's also a term that I have come across. I don't remember the full form of it. It's called N.E.A.T. Non-exercise activity something, where you basically keep moving around. Whether even if you're not exercising, you keep moving all the time in some form or the other.
Yes, that the concept also came, started coming to in offices mostly, where they have started introducing standing desks.
Yes.
And they have, like generally also you get apps that send reminders. I think Apple phones, iPhones also send these reminders that you have been sitting for some time.
Yes.
Get up and take a walk.
Yes.
So the concept is obviously when we walk, what happens? The moment we are sitting, our legs are like the peripheral hearts. So the
legs are the peripheral hearts.
Legs are the peripheral hearts. More specifically, if I say, the calf muscles are your peripheral hearts. So when you move, when we are like sitting, a lot of blood, a lot of fluid gets pooled into the leg vessels. Let's not get it too technical, leg vessels. And the moment you get up, when you start walking, your calf muscle starts contracting, which pushes those blood back to the heart. So that is one of the concepts of getting up and moving, that you should keep there should not be much stagnation of blood in the legs. So you get up, that circulation improves, and again you take a 5 minutes walk, and then you again set for your work.
So he's talking about Arnab, or Dr. Arnab just spoke about how your legs are your peripheral hearts. But then, now let's go back to the studio and discuss other things, because I am drenched. My legs are now aching. My peripheral hearts are tired. So I think we should head back to the studio and and continue our discussion there.
Yep, sure. Let's go back.
Now that we're back from the great outdoors, thank you for that lovely field trip, Dr. Arnab. We were talking about our lifestyle and everything. Do you have anything more to add from that perspective, where you spoke about movement, where you spoke about N.E.A.T, where you spoke about all of these things that we can actually do? So how does one lead a complete life for their heart?
So if if I can break it down.
Yeah.
So first is food. With aging, obviously the amount of food we consume, the
Hmm.
calories we are consuming, the proportion in which the food is being consumed, like the protein, the fat, the carbs. These are all something which are things which are available online. These data, the what, how much we should have.
Yeah.
So that should be obviously there. But what I would like to add here is to avoid sugar, processed food,
Hmm.
as much as possible. We cannot, okay, we cannot go without having a burger or having a biryani from time to time, but don't have biryani every day, every meal. That is my point.
Yeah.
We like fried food, so we can have fried food. That doesn't mean that I don't have any heart disease right now. Should I stop having oily fried food? No. But obviously, you cannot make it your lifestyle that you are always having fried, oily food. So you have to balance it out. Healthy amount of fruits in your diet, fiber in your diet, and obviously, if you when you're post 40 or you're checking, if you don't have sugar and all that, diabetes. If you have diabetes, then obviously then the diet thing obviously changes
Yeah.
a lot. Uh, that is one part. The second part is exercise,
What we
movement,
spoke about. Yeah.
exercise.
Yeah.
What I forgot to say then was, if you are into yoga, do yoga, breathing
Yeah.
exercises,
Yeah.
because those will help you reduce your stress. Now, the most important thing, apart from all these, is sleep,
Yeah. We never.
which we never talk
Oh
about,
my
which we
God.
don't say.
Sleep and
8
I
hours
are.
of sleep
Yeah.
is recommended, but at least a 6 to 7 hours of uninterrupted sleep is required. Don't lie awake at 2 to 3 a.m. in the night. Your hormonal levels, your circadian rhythm
Yeah.
will go for a toss.
Yeah.
Again, these kind of things, when you were younger, when we were younger in our 20s, wouldn't have made a difference. You stay up till 3 4, then next day morning at 7 you are up and about, you are going out, be doing some, like going to play or something like that. But as you grow older, you will see the difference. I see
Mm.
the difference
I
in
see
my
the
life. I
difference.
see,
Yeah.
if I am tired, I need to go to sleep.
You still pull off 36-hour shifts, man?
But still, I need to put, like, still, right, as I'm growing older, the 36-hour shift seem longer,
Yeah.
seem more tiring
Yeah.
than when I was the first year resident.
Right. Makes sense. So sleep is something that I understand, that
Sleep,
that kind of like really, and it also helps cortisol, right? Which
yes,
basically is
is a,
responsible for your heart health to a certain degree, because that
yes,
it sort of
stress hormone,
stress levels,
stress hormone,
inflammation and stress
stress reducing hormone.
is something that is going to put more and more pressure on your heart, right?
Yes. So, food, exercise, sleep, avoidance of
Stressful situations.
stressors you cannot avoid fully. Avoidance of, I wanted to say, tobacco and alcohol. Number five, reduction of stress. But again, it depends upon what kind of line of work you're in. But obviously, undue stress,
Yeah,
if you can avoid it, it's always best avoided. I think as you grow older, you tend to fight less also.
that is true.
You tend to see that this is not something that adds any value to my life right now.
I think sometimes you tend to fight less, but you also tend to get more stubborn because you get more set in your ways. So I don't know that, which is why the habit forming thing, what you said in terms of your lifestyle, is very important, that you get it right as soon as possible.
As soon, like, that is what, like, I am doing it.
Hmm.
You are doing it. I'm
Trying to, trying and failing, but trying.
but I think you are doing it. Like, you don't need to be. See, that's another. If I talk about millennials now, that's we are set in a way. Our upbringing, bolo, yeah, whatever you say, is set in a way that everything has to be perfect. It doesn't need to be. You don't need to hit the gym every day.
Yeah,
You
true.
need to be persistently or like frequently hitting the gym at a regular interval.
Yeah,
It doesn't need to be like, you don't need to go pull like 50 kgs of
yeah,
like bench press or something like that. You
yeah,
don't need to do that.
yeah.
You need to go and get 10 minutes of walk on the treadmill. That's the bare minimum. Maximum is the sky is the limit. You achieve whatever you want.
That is true. That
So
is true.
that is, I think, what I've seen in a lot of our like generation people, friends who, especially if I may, friends who have grown up in Calcutta. So you might did that one out, but yeah.
So, you were saying, continue.
So they like have been said like we have to be the best version of ourselves. We have to
Hmm.
do this perfectly.
Hmm.
ना नहीं तो नहीं छोड़ दो ऐसा type
Right.
stuff.
So perfection is the enemy. Consistency is the
Is
friend.
the friend.
Perfection in this particular thing is the enemy.
Yes, absolutely.
So just to sum it up, if you have to say like in 3 lines on this, because world hard days tomorrow itself, 29th, like you said. So if in 3 lines, if in 2 or 3 sentences, if you have to summarize everything up that people should do to take care of their hearts and things that they should know, be aware, what would you do? I know we spoke a lot about it, but just as a takeaway, what should people do?
So now first takeaway would be prevention is better than cure. So be active, eat healthy, do your regular checkups if you are like more than 40 or if you have family history. Be aware. Now the second point I would, which I haven't spoken about is be aware of heart symptoms. Like if you are having a chest pain or if you're having unsweating, if the chest pain is going to your left side hand, if you're having a chin pain also. Sometimes heart attacks come as dyspepsia. Like dyspepsia, by dyspepsia I mean like bloating sensation. So if you're having a persistent symptom, get a doctor's opinion done. Do not have a pan and say that okay, I will have another pan. Have one pan day. If it does not subside, and if you are of that age or you have a family history, think in the back of your head that okay, this might be something else.
Right.
And number three, spread the word around. Tell your friends to be more aware, to be better at taking care of their own health. We are responsible for our own health, nobody else's.
That is a massive thing that I don't think we know it, but we don't really internalize it. The fact that you are responsible for your own health and you need to take care of it. Nobody's going to come and tell you that to do this or to do that. So on that note, thank you so much, Dr. Arnab, for being part of the Rangman Show. I had a very entertaining chat. I really liked all the stories that you told us, and especially our jog was also quite nice. If I may call it a jog, I think it was more of a snail's walk. But thank you again for joining us on the Rangman Show, and we'll come back with another guest for you so that you guys can watch us. And could you just please ask them to like, share, and subscribe because they're not listening to me for sure. So
Please like, share, and subscribe to the Rangman Show. And thank you for having me here.
so you heard that good doctor. अब डॉक्टर की इंस्ट्रक्शन तो आपको माननी पड़ेगी. तो please like, share, and subscribe, and we'll see you again. Thank you so much.